Hi everyone, welcome to Living a Balanced Life with Julio. Today's episode we're going to talk about coronavirus or COVID-19. I got a couple of requests from people to do a video about the coronavirus and to shed some light about the fear and the anxiety that's going on with the coronavirus, and then also differentiate between that and the common influenza that claims a lot of lives as well every year. So if you're interested, please stay with me. Coronavirus doesn't describe one type of virus. Coronavirus is a group of viruses that can cause illnesses such as the common cold to acute respiratory syndrome like SARS. Coronavirus is normally found in animals, and this is the first time, the novel coronavirus, which is the current one that's in fact the first time humans are being infected by it, and this is why they're scared, because there's not that much that's known about it at the beginning. Of course, now there's tons of information. If you go on the website of the World Health Organization, Health Canada, there's tons of information about the coronavirus, how it's spread, the symptoms, and also ways we can prevent each other from spreading the virus, and what to do if you get infected. So there's tons and tons of information. Of course, I recommend that if you want to get information about these kind of viruses, you check a source that gets updated most often, which is the World Health Organization website. It gets updated as the information about the virus is known to them, and also Health Canada, because this information is valid. You don't want to just watch any video or watch any kind of, read anything about it, because there is a lot of anxiety and a lot of fear about what's happening in the world, and in terms of what people should do, and if I get it, does it mean I'm gonna die? All of that information. You want to get the best information that's research-based, that's evidence-based, that can help you, inform you and inform your loved ones, and so we can all work together to prevent the coronavirus or COVID-19. So, like I said earlier, it's a group of viruses that can cause respiratory illnesses. Just to give a little bit of stats, because a lot of people are anxious and there's a lot of fear about the coronavirus. Just comparing the coronavirus to the common cold. For example, the coronavirus so far has infected about over 100,000 people, and over 3,000 people have died from it. But comparing it to the common influenza, just looking at USA alone, this flu season, there's been about over 20,000 deaths from the flu. There's been about 34 million people that's been, that have gotten sick from the flu, and over 350,000 hospitalizations because of the flu. So in comparison, the COVID-19 is much lower. Of course, people are anxious because it's a new virus. There's not a vaccine for it, and researchers are working on it, and we're learning as we go. And that's usually that's what's causing the fear. But I just want you to rest assured that as long as you are practicing proper hand hygiene and proper food handling, and using the prevention measures, making sure that you're washing your hands, you are getting enough sleep, you're getting enough rest, all of that will help you stay healthy, keep your immune system up to par, and even if you do contract the coronavirus, you won't necessarily die from it, because it's not a death sentence. Comparing the mortality rate from it, like I've said throughout this video, is much lower. We just all have to practice working together to prevent from the spread of it, and spreading it to other people, so we can all live and prevent ourselves from getting sick, and making the people among us that are vulnerable, people with immune system compromise, can also stop them from getting sick and prevent them from dying from it. So the elderly and people that have illnesses like diagnosed with like diabetes, people that have respiratory diagnoses like asthma and bronchitis, and all of those all have a higher chance of getting really sick from if they ever contract the coronavirus. So we want to make sure that we protect ourselves, protect them, and then protect each other, so we're not spreading. Of course, coronavirus was first discovered in China, Wuhan, China, or mainland China, where a lot of patients were coming into the hospital with undiagnosed pneumonia-like symptoms, so respiratory symptoms, and they're trying to figure out what was causing it until it was discovered that it was the novel coronavirus that's causing these symptoms, or causing this illness. So let's step back a minute. Coronavirus, the mortality rate for coronavirus is much lower compared to the influenza virus, for say, or the Ebola virus or SARS, right? So the mortality rate, so for example, if 100 people get infected with coronavirus, the mortality rate is about 2 to 2.4%. So if it means that if 100 people get infected, about 2% of those will be will have an increased chance of passing away or dying from it. Whereas if you compare to Ebola, which was also caused a lot of fear in the past, the mortality rate of it is greater than 40%. Right? Some even report that up to 70% mortality rate. So if 100 people get it, about 70% of the people will die from it. And compared to SARS, which was also an issue in the past, and also acute respiratory syndrome, that mortality rate for SARS was about 10%, 10 to 11%. So if you compare the mortality rate for SARS, for Ebola, and for COVID-19 mortality rate is much lower. Of course, people are afraid, and the anxiety is due to the fact that this is the first time this type of virus has infected human, and we don't have any vaccines in the meantime to treat it, and that we're learning a lot about it as scientists work on the virus to find out ways we can prevent the spread and prevent people from dying from it, right? So I just want to put it out there that, for example, if you go on statistics, USA, more than just in US alone, over 34,000 people die from the common flu virus, compared to the COVID-19, which have killed, as the last time I read, it's killed about 11 people. Right, so it's the mortality rate is much lower, but of course prevention is the best medicine. So there are no treatment for it, so making sure that you're protecting yourself, you're protecting your loved ones, and protecting we're all working together to protect the society, so we're not spreading it to everybody, is the best way to help all of us stay safe, and to stop all of us from, getting contracted this infection. So what is the coronavirus? Coronavirus is an umbrella term that describes a bunch of viruses that can cause similar to common colds to severe respiratory syndrome. So coronavirus is an umbrella term that describes not just one type of virus, but multiple types of virus that can cause illnesses when introduced into humans. So the coronavirus that's currently people being infected by is called the novel coronavirus, or the COVID-19, and it was first discovered in China when a lot of people came in with unknown or undiagnosed pneumonia-like symptoms, and for some people ended up dying from it. So the coronavirus is originally spread from animals to human, and this is the first time that humans have been infected by this type of the novel coronavirus. And because of that, of course, there hasn't been any vaccine developed yet. Of course, scientists are working on really hard to come up with a vaccine, but as of now, there's no vaccine for the current coronavirus that's causing respiratory infection for people. So why are people so anxious about the coronavirus? It's because the fact that there's no vaccine for it, and this is the first time that it's infecting people, and there hasn't been a lot of medication, and there was not that much information about the type of coronavirus that's spreading. So that's what's causing the anxiety. Symptoms for COVID-19 is very similar to the common cold or the common flu, right? So the symptoms include fever for some people, chills, runny nose, sore throat, for some people, difficulty breathing. These are all some of the symptoms of the coronavirus, which is very similar to when a person is sick from the cold or from the flu, right? But of course, with the COVID-19 or the flu, you get more severe respiratory distress. So if you start to manifest these symptoms, it could be signs that it's a common cold. But of course, if you've traveled to the areas that's called the high risk areas, then you should be mindful to stay in isolation to prevent yourself from spreading it to other people. So if you've traveled to, for people that have traveled to China, Hong Kong, Italy, South Korea, Saudi Arabia, of course, certain places in USA and in Canada, because there are cases there. These are all areas that you have to be mindful that if you travel to this area, the chance of contracting this virus increases. And if you've been to these main area where the illness is spreading much faster, then you need to you need to not go to you don't need to go to the hospital if you're not having any major respiratory symptoms. So for example, if you have chills and fever and sore throat and all of that, you can and you've traveled to these places, of course you can call public health and to whatever area you live in, call public health. They will direct you as to the next steps. But the main thing is you want to isolate yourself, meaning that quarantine yourself at home from giving it to other people, because this virus can survive on surfaces of glass and table and all of that, doorknobs. It can last for a while. Of course, the exact length of how long it lasts on these surfaces is not 100% clear, because we're learning about this virus as scientists are doing their research. But we know that the other coronaviruses can last on surfaces for about a day, right? So you want to be mindful that if you travel to certain areas in the world that has high coronavirus outbreak, then you quarantine yourself, you stay home. And of course, if your symptoms get where you're not able to breathe, you have respiratory symptoms, or you feel dehydrated and you're not being able to tolerate any kind of food or fluid, then of course you need to check into your local emergency department, and where you can get supportive care, where they'll give you fluids and the necessary treatment to give your respiratory system a break to help you with breathing, so you that doesn't cause other complication or death for you. So not everybody that have the coronavirus need to rush to the emergency, because every time we do that, we're spreading it, unless you have acute respiratory syndrome or acute respiratory distress. Then you need to seek medical attention that way. So it's very important that we know how to prevent ourselves from giving the coronavirus to other people. Of course, like I said earlier, the virus is spread through droplets, right? So it's droplets precaution for those that work in the hospital, or for those that want to stop the spread. It's droplet, it's not airborne. A lot of people ask me, so if I'm in the same room with someone, I'm automatically gonna get it. That's not true. It's not airborne, but it's through droplets. So if someone coughs, the droplets from the virus in the saliva that travels can end up in someone's eyes, someone's nose, someone's mouth, and this, like the T-zone, it can and then people can get infected that way. So in order to, as we're learning about the virus, most of the people that stay in close proximity to someone that's infected, so about 2 meters from someone that's infected, for more than 15 minutes, have a higher risk of contracting the virus, right? Because, they cough. If the people are not practicing good cough and sneezing etiquette, then this is spreading. So if you're sneezing and you're not, sneezing into your arm or sneezing into a tissue, then that increases the way the virus spreads. So other people can contract it. If you're sneezing into your hands and then you're touching surfaces, of course, then that increases the risk, because you're leaving the viruses there for other people that touch it to contract the disease if they touch their eye, their nose, and their mouth that way, right? So we want to be mindful and practice good sneezing and coughing etiquette. So that's how the disease is spread. So it's through droplets through sneezing and coughing from the infected person in a close proximity with the person for about 15 minutes or more within 2 meters away. As of now, there's no vaccine for it. There are other medications like chloroquine that that other countries or other health systems are using in different parts of the world just to help treat some of the symptoms, the respiratory symptoms, but it's not a treatment for coronavirus, but those medications are added to treatment. Depends on what's happening to the person to treat some of the symptoms. Prevention is better than cure, they always say, so it's important for us to prevent ourselves from spreading it. And how do we do that? Just like with the common cold and flu, same thing. Right? So if your immune system is up to par, meaning that you have a strong immune system and you don't have any other comorbidities or any other illnesses, then even if you contract the COVID-19, your chance of getting really, really sick and dying from it is much lower, right? So what we've known so far, what we're learning so far, is that people that are immunocompromised, so people that have diabetes, people that have chronic illnesses like or have cancer, that have immune system deficiency, those people, of course, are vulnerable to getting these viruses because their immune system is already compromised, right? So the elderly also as well. So if you have a family member that's in a nursing home or long-term care, you have to let them know that you can't visit as much because we're trying to contain the virus and not spread it to everybody else, right? Because if an elderly person gets the coronavirus and an elderly person that has other comorbidities or other illnesses, their chance of dying from it is much, much higher because the immune system is not as strong, right? So not everybody that gets the virus dies from it, right? So if you're someone that travel to these kind of high areas, or you live in an area where the coronavirus is much spread is much higher, then you need to take precautions. So the same thing, when you are sneezing or you're coughing, you practice good coughing and sneezing etiquette, meaning that don't just cough into air, because then we're spreading the virus. So when you're coughing into your sleeve, right? You cover your mouth, or if you have a tissue, you cough into the tissue, you close it up, and then you dispose of it right away. So that's a way of containing the virus so you're not spreading it around. Of course, hand hygiene is the number one thing to do, because when you wash your hands, you're washing off the germs or the viruses off your hand, and you're getting rid of it. Right, so hand hygiene is it's very important. Of course, making sure that you're washing your hands for more than 20 seconds is ideal. If you want to make sure that you're washing your hands and you're meeting the length of how long you should wash your hands, so while you're washing your hands, you sing the happy birthday song twice. So happy birthday song to the end twice, and that makes sure that you're getting about over 20 to 40 seconds of washing to make sure you're getting rid of the virus. Of course, when you're washing, you wash under your nails, you wash everywhere to make sure that you are cleaning the viruses, or you're getting rid of the virus from your hand. If you don't have access to soap and water, then just like you use alcohol-based hand sanitizers. So same thing, you squirt some and then you put it all over your hands, in between your knuckles and underneath your nails, to make sure that you're getting all the areas covered. And of course, you leave it to dry. Very important. So tell your kids, if you have children, pass it on, that when you put hand sanitizer on, you don't put it on and then wipe it off, right? Because like the word, we're in a hurry all the time, we want it to dry right away. It takes a little bit of, so keep rubbing it until it dries completely on your hand. And when it's dry on your hand, that means that you've gotten rid of the virus. You don't put it on and then rub it off or pat it in your clothes, because that kind of defeats the purpose, right? So make sure that if you use hand sanitizers, that you're waiting for it to dry before you go about your business or whatever you're doing. Of course, if you use the washroom, please wash your hands. If you go out and you come back inside the house, wash your hands. Areas that you touch most of the times, like the doorknobs and the refrigerator doors and all of that, you want to be disinfecting as frequently as possible. So there are sprays that you can use, or you can use alcohol-based disinfectors. Follow the instructions on the product and to disinfect the surfaces, right? Because like I said, the virus can be on the surface for about a day, right? So you want to make sure that you're disinfecting as much as you can. Is it recommended for you to wear the surgical mask? No, you don't need to wear it, because if you're a healthy person and you don't have the virus, you don't want to wear a mask where most people don't know how to dispose of it properly, right? Or get rid of it properly, so you might contaminate yourself. So it's not a good idea for you to get the surgical mask. It doesn't really protect, unless you have the coronavirus and you're in quarantine and you need to you want to like extra precaution to prevent the spread. So for example, if you have it and you're going to the hospital because now your symptoms have gotten worse, let's say, then you wear that because it helps you at least contain the virus, in the sense that if you cough, it's not going out there in the air for other people to contract it, right? So it's not recommended if you're a person that's healthy and you don't have it to necessarily wear the surgical mask. Of course, if you work in a healthcare organization, there's trainings out there to help you learn how to put on the mask and the protective gear properly, and how to take it off properly, because that's just as important, so we don't contaminate ourselves or contaminate the environment and spread the disease that way, right? But your organization will go through it with you to make sure that you're getting rid of, you're putting it on properly and you're taking it off properly to prevent the spread of the COVID-19. Another way of making sure that we're not spreading is, if you do have the virus, please take care of yourself, meaning drink lots of fluid, eat healthy, eat a balanced, healthy meal. Make sure that you are not, out there in the public, because like you said, if the virus takes for some people, it takes about 9 to 14 days to actually show symptoms. So a person can contract their illness and feel completely fine, no symptoms, until about 9 to 14 days later. And people that have really strong immunity, they might not even get much symptoms, right, from the COVID-19, but that doesn't mean you can't pass it or you can't spread it, right? So if you live in an area where you're being warned to self-quarantine or self-isolate, then please follow that instruction so we can all be protected and prevent the spread, so we can get rid of this the virus that's causing a lot of anxiety in the world. Another way of making sure that we are preventing ourselves from the spread is that if you're sick from even the common cold or the flu, stay home. Same thing, stay home, because you can, if you have the flu or or cold and you go to work, you are spreading that as well, right? So of course, if you work with people that are vulnerable, then you're spreading it to them. They can get sick from that. Their immune system become compromised, and then if they ever were in contact with a person who have the coronavirus, their chance of getting it increase, because their immune system is not as strong. These conditions like diabetes and all of those, of course, you are taking care of yourself, so you're keeping an eye on your blood sugar. If you have your blood pressure is high, you're keeping an eye on your blood. If you're taking your medication as prescribed, you're eating a balanced, healthy meal. If you can do some physical activities, you do that to help boost your immune system, so you stay healthy. And if you're ever in contact with someone that have the coronavirus, it prevents you from, even if you do get it, you're not as sick from it, or you don't die from it, right? So this coronavirus prevention is just the same as preventing the common cold and the flu. Eating healthy, exercise, and making sure that you are practicing good hand hygiene and proper coughing and sneezing etiquette. So making sure that whatever areas that were touched, most of the time we're disinfecting it, so we're not spreading and leaving the viruses around for other people to get it. Avoid touching your eye, your nose, and your mouth, which is the T-zone. Avoid touching there, because that's how you can get the virus into your mucous membrane and then get yourself infected that way. If you are sick, stay at home. If you travel to areas that have these viruses, like China, Italy, South Korea, Saudi Arabia, all these areas, then make sure that you are, when you report back to your country where you're from, or if you travel and you come back, make sure that you contact public health, so they are aware that yes, you did travel to these places, that they will give you the next steps as to what to do to prevent yourself from getting more sick and from spreading to other people. Keep yourself in isolation for 14 days. After 14 days, if a person with coronavirus doesn't have any symptoms, that means themselves, they're fine, but there's still lingering time where you can pass the virus to other people. So, still be mindful, practice good hand prevention hygienes, and that will help all of us, stay safe and be healthy, and hopefully help reduce the fear of the coronavirus, and we get the right information so we're informed, and our loved ones are informed, so we can all protect ourselves. So the coronavirus is not a death sentence. Of course, it has caused over 3,000 deaths in the world combined, and it has up to date, I think it's infected about 100,000 people, but not everybody that got it died from it. So the mortality rate, like I said earlier, is about 2 to 2.4%. So it's very low. As long as we're practicing, the prevention, taking precaution, and practicing proper hand hygiene, proper etiquettes, that will help all of us stay healthy and help each other get rid of this virus, so we can all go back to our normal life. But remember, the coronavirus is a virus, and just like the influenza virus, just like the cold viruses, right? So whatever you're doing for that is the same thing. Influenza virus kill more people every year than the coronavirus have killed. So just continue to practice these infection control prevention measures to help all of us stay healthy. So that's what I have for you for now. Stay current, stay informed. We want to make sure that you are keeping yourself safe, you're keeping your family safe. Listen to the news if you are someone that can, like, for example, have access to computer or whatever. Listen to the news. There's always updates about the new virus and things that we're learning about it, so you stay informed. You want to get evidence informed information, not the fear, anxiety-packed information that make you feel worse and weaken your immune system and make you sick anyways. That's not what you want. So if you're someone that can have access to computer, go on World Health Organization. The information get updated most of the very currently, and as researchers find information. Health Canada, like whatever country you're from, look at their website, their health website, because that will have the most evidence-informed, researched based information that can give you the information you need to protect yourself and protect your loved ones, so you don't contract this coronavirus. So until next time, stay healthy, eat healthy, exercise, avoid going to crowds. If you don't need to go to an area where it's like a crowd, then stay away, because the less people you come in contact with, your chances reduce. Practice your etiquette, it will help you. But if you don't need to go to crowds and to games and to things, then you stay away from that. If you're someone that is traveling, make sure that you are following all the current travel advice about coronavirus and all of that, because you don't want to go to an area where the virus is much higher and spreading much higher, where there's a chance of you being quarantined there, or there's a chance of you bringing the illness and spreading it in your local area that you live in. So let's all be vigilant, and let's all work together so we can stop. If you have pets and you live in an area where coronavirus is much higher, or even anywhere that you live and you have animals, same thing, you need to protect your animals, because coronavirus can infect animals as well. So you want to make sure that you are not sneezing on your animal, you're not, cuddling too much with your animal, kissing, they're licking your face, all of that. Try to avoid contact. If you think you might have the coronavirus, try to avoid that, because you can give it to the animal. And then of course, anybody that lives in your home that also play with the animal can get it that way as well. So of course, as of now, there's no evidence to say that animals can pass it on, our pets can pass it on to us. But just like, they're part of the family, you want to make sure that you are taking care of yourself, you're taking care of them, so then you're not spreading the germs, the virus to them, and then they're not spreading it to other people as well. Making sure that we're disinfecting. If you have kids and they have a lot of toys, make sure that you're cleaning the toys, if you get like warm water and soap, and wash it off and dry if you can. If you can't, then use disinfecting sprays. The ones follow the instructions on to make sure you're disinfecting all surfaces, because the virus can stay on the surface for a while, where if people touch that and then they don't wash their hands and they touch their eye, their nose and their mouth, it can get into their mucous membrane and they can get the infection that way. So making sure that we're doing that is very important to protect ourselves and to protect other people. Comment section, if you have any questions, let me know as well. Health Canada information there, so you can check it out as well, because you want to get evidence-informed information to help you stay current and stay safe. So until next time, take care, and hopefully by the next time that we're talking, it won't be about coronavirus, it will be something else, because the coronavirus outbreak will be going down. So take
exclusive.